Due to COVID-19 pandemic, everything has changed. On the 31st night of December in the year 2019, the first case of coronavirus was confirmed by the World Health Organization located in Wuhan, China. It was later on announced in Thailand that they also have confirmed cases in which is known as the first case of coronavirus outside the mainland of China. On January 25th of 2020, a 39-year-old female from China had symptoms of cough and sore throat. Millions of Filipino workers lost their jobs. Thousands of businesses came to an end. Several students could not afford to study anymore, and those who are poor became the poorest. Who does not have enough money won't survive. Either they will die from the virus or die from hunger. People who got weak immune system and pre-existing health condition gets a higher risk of health problems, and we shall not forget those who are not mentally stable. Due to this pandemic, mental health conditions has a higher possibility of developing for the reason that there are no social interactions and people around you tend to be uneducated towards mental health awareness. COVID itself can lead to neurological and mental health complications such as delirium, agitation, and stroke. All the time spent alone, overthinking everything can cause depression, which is an extremely serious mental health condition that can be deadly if not treated.
I am Stephanie Gwen Domingo, and I am diagnosed with depression. Based on what I remembered, the last time I smiled is when I'm with my friend. I felt happy that time because there is a person by my side. But I'm having a hard time to tell her what is happening to me. So I act everything is fine and everything is okay. I think 10 because I felt extreme level of sadness and pain. I can't even control my emotions. Out of nowhere, I became emotional and started to cry. I usually enjoy painting and going out with my friends. But when depression hit me, I lost my passion. I felt like there is no reason for continuing the things I love to do. And before, I loved to socialize with other people. But now, I want to be alone most of the time because I feel like I'm not existing anymore. Yes, food is not appealing to me anymore. For no reason at all, I didn't felt hungry. I just want to cry and to be alone. It gets bigger since I didn't eat most of the time. I started to experience weight loss from 45 kilograms to 35 kilograms. These past few weeks, I commonly stay up late. It is hard to sleep because there's a lot of thoughts in my mind. I think my mind was about to explode that resulted of almost not sleeping. Yes, I always thought that taking my own life is my ultimate escape from depression.
My name is Owen M. Espiritu, father of Stephanie who was diagnosed with depression. I noticed about my daughter when she was suffering depression. First, what the action was fine. She ate right on the time, she went to bed early, and I could talk to her politely and calmly. But a few months later, I noticed that everything was changed about her. When she came home after class from school, she would go straight to her room and be locked up. Then, whenever we asked her to eat dinner, she would respond that she will eat, but in reality, she would not eat. Since then, she has been losing a bit of weight because she was not eating at the right time. And every time I talk to her, and when I accidentally raises my voice while I was talking to her, she suddenly gets angry and irritated. And then I could not talk to her properly because of that. And I also noticed about her was that she was always lethargic and had no appetite.
When I woke up every morning, I feel empty, always feeling worthless and hopeless. I started with feeling irritated over small issues. I didn't look forward to spending time with anyone. I also lost my appetite. I felt like food is not appealing anymore when I feel anxious, worried, or feeling hopeless. For no reasons at all, I was getting angry at home, and I didn't feel like I am existing. I was losing enthusiasm for life and struggling to enjoy the things that would usually make me happy. I also felt difficulty in thinking, concentrating, or making decisions. Some people understand it, and some people think I am only calling for attention. It is hard to talk to people when you do not know what happened or what reaction you will get. In the past, I found out that people were talking behind my back, saying I am needy or always talking about myself. But maybe I seem to be like that because I need a person to lean on.
Due to the symptoms of Stephanie's illness, her family took her to a psychiatrist to find out what Stephanie's illness really was.
Since this patient was referred to me, at our first meet, I noticed that she appears to have trouble in concentrating, speaking slowly with long pauses. She's avoiding eye contact, she was speaking with low speaking voice, and she seems agitated. As she describes her symptoms to me, I take a note about how she feels, the way she thinks, and how she acts. I find out that she was feeling sad as she had loss of interest about everything. She has trouble in sleeping, thinking, concentrating, or making decisions, and thinking frequently about death or suicide.
Thinking that she may have depression, I rule out other conditions that may cause depression with a physical examination, a personal interview, and lab tests. The examination results help me to make an accurate diagnosis and ensure effective treatment, so I prescribe antidepressant drugs as her medication. Antidepressants aim to correct chemical imbalances of neurotransmitters in the brain that are believed to be responsible for changes in mood and behavior. It can help jumpstart mood and give people the boost they need to get over the symptoms of their depression. This often allows them to start doing the things they enjoy again and make better choices for themselves, which also helps contribute to a more positive mood. Antidepressants can help improve your mood, help you sleep better, and increase your appetite and concentration.
As I observe her behavior from her first meet to be followed by her few consultations, I can see her improvement as she seems less irritable or appear to have more energy during her visits. And I found out that her appetite has returned and she's having an easier time functioning in her daily activities. And that is another good indicator that she's progressing.
Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. 13% of world's population in 2020 have mental issues, and there is a high percentage of people diagnosed with depression. This mental illness causes feelings of sadness and loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at school, work, and at home. So when the brain's impact on depression, nerve cell connections, nerve cell growth, and the functioning of nerve circuits have a major impact on depression. Brain cells usually produce levels of neurotransmitters that keep senses, learning movements, and moves working along. But in some people who are severely depressed or manic, the complex system that accomplish this go awry. For example, receptors may be oversensitive or insensitive to a specific neurotransmitter, causing the response to its release to be excessive or inadequate. A message might be weakened if the originating cells pump out too little of a neurotransmitter, or if an overly efficient reuptake mops up too much before the molecules have the chance to bind to the receptors on the other neurons. Any of the system faults could significantly affect the mood. These said neurotransmitters have different descriptions that is believed to play a role in depression, like serotonin that helps regulate sleep, appetite, mood, and inhibits pain. Research supports the idea that some depressed people have reduced serotonin transmission, so low levels of serotonin byproduct have been linked to a higher risk for suicide. Next we have is norepinephrine that constricts blood vessels, therefore raising blood pressure. It may trigger anxiety and be involved in some types of depression. It also seems to help determine motivation and reward.
We have dopamine, which is essential in movement. It also influences motivation and plays a role in how a person perceives reality. Problems in dopamine transmission have been associated with psychosis, a severe form of distorted thinking characterized by hallucinations or delusions. It also involves in the brain's reward system, so it is thought to play a role in substance abuse.
People developing depression often show symptoms like feeling sad, loss of interest in activities once enjoyed, change in appetite, You can also notice change in their weight, either loss because of diet and gain because of stress eating. They can also experience trouble sleeping, and on the other hand, they can also tend to oversleep. Difficulty in thinking, concentrating, and making decisions can be noticeable too, and in some severe cases, they have thoughts of death or suicide. Fortunately, it is treatable. Between 80 to 90% of people with depression eventually respond well to treatment. Medications like antidepressants may produce some improvement within the first week or two of use, yet full benefits may not be seen for 2 to 3 months. Overall, depression affects people from all walks of life, no matter their background is. It can affect people of all ages as well. Unfortunately, there's still a stigma that surrounds mental health issues, and some people view disorders like depression as a weakness. But similar to the way anyone can develop certain physical health issues, mental health issues aren't always preventable. Keep in mind that mental health is as important as your physical health. When symptoms occur, consult your doctor.
Depression is not rare. It can be diagnosed as young as 3 years old. As one of the nurses that deals with the psychiatric ward in a rehab center, it is something that I come across almost every day. There was a point in my life where I would also question my sanity and how I could handle such patients, especially those that leaves impacts on me. I had one patient that was struggling with extreme post-traumatic stress disorder. PTSD happens if a person experiences something very violent that it caused the brain to get stuck. Basically, their brain stays on high alert. It gets stuck in danger mode, which is not normal. This patient of mine experienced years of domestic violence, and when we had her, we couldn't go near her because she was always frightened and would always shout. Until now, she is still undergoing cognitive behavior therapy. Just like what I said, depression is not rare. The age group that has a high rate of depression starts at 18 years old to 25, followed by 45 to 64 years old and 65 years old and over. When I was still practicing as an intern, I remember this old lady that was a patient in the rehab center I worked for before. At the age of 48, she was struggling with depression. I considered it as an extreme case because at her stage, she developed an eating disorder. Sometimes she'd punish herself by not eating for at least 2 days, and sometimes she would overeat. She showed major depression symptoms and has been going to different therapists until this year. 1 in 4 people struggle with mental health at some point of their lives. Whatever your situation, it takes real courage to face death and step back from the brink. You can use that courage to help you keep going and overcome anything.
As a psychiatrist who diagnosed Stephanie, I could tell that depression is not easy. The hard part about depression is actually finding the energy and motivation to do something about your depression. That's why a lot of people feel stuck. The most important thing to remember about seeking depression treatment is simply to speak up and ask for help. Depression is not a sign of weakness or laziness. It's a sign that something is out of balance. Thankfully, with proper treatment, you can feel well again.
I remember when I almost committed suicide last year. I was offline for months and nobody knew what happened. I don't know how it happened, but I'm grateful to be alive today. To anyone who's going through depression, I always pray for you to find peace like I did. My advice for all is depression has no face. The person who appears to be the happiest could be carrying the biggest burden. Always be kind and always shed a light for someone who is struggling in the dark.